Hello, this is Dr. Do again. This video is alphabetic list of problems, still on letter H. Today I'm going to talk about a condition. Could be very serious, it could be very subtle, and could be difficult to manage. It could be easy to correct. So, which is the hypovolemic situation, especially in the summer. It could happen. Particularly in the elderly people. If you recall, there's some incidents occurred probably decades ago in a city. There is a heat. A lot of people suffering the heat stroke. The major complication of this heat stroke is the lack of the volume, so loss of fluid. So that is one of the example that quite serious associated with this hypovolemic. So let me just bring up the emergency situation associated with this hypovolemic. Is there any? Of course, I already just gave you the example. This could be acute injury, losing blood can definitely cause the hypovolemic, or long-term dehydration for those elderly people, particularly those dementia or altered mental status, or the retarded or the slow people couldn't sense the thirsty, or some other systemic disease that lost the sense or lost the hormone regulation. These are all the conditions that can lead to the acute hypovolemic, which is quite dangerous. So if that's the case, of course, you know the injury, lost blood, that's the first sign, go to the emergency. Or if you're living with people, you're taking care of people, elderly or retarded or dementia, then you just need to be alert. I'll give you some signs. What are the signs for the minor hypovolemic? So you check it and then you know it, and then talk to your physician, go to the emergency room. Is there any conditions associated with this hypovolemic that you can manage home? Of course, just replenish with the fluid, juice, or add a little salt or without salt. It depends on the situation. But what I'm talking about is are the people really at risk of serious complications because of this hypovolemic. So let's talk about the volume maintenance in the body. Usually for standard, usually international standard means 70 kilograms in terms of weight, and the 170 centimeters for the height. So that's the standard. When we talk about the standard, that's the standard. Could be varied. You're probably 180 centimeter or probably 80 kilograms. But when we talk about the standard within this range, 70 kilo, 170 centimeter as universe in the medical field, considered as standard, about the 4 to 5 liters of circulating volume in the blood vessels. So any causes, like I said, either from the acute injury, can lose it 10%. Easily to lose 10% if without any replenish. There's insensible loss or sensible loss without any injury. The sensible loss we know can measurable, which means through the urine output. The insensible loss, that's count about 500 cc a day at least. Especially in the summer, could be more. In the winter, could be less. But still, this insensible loss has to be replenished through the perspiration. Either you know you are sweating, even though you're not sweating, still there's some fluid loss out through the skin. So so when we talk about the hypovolemic or the daily fluid intake, 2500 cc, that's the standard for the daily requirement to maintain the normal volemic condition for the feelings of not thirsty, or for the basic fundamental metabolism. On top of that, if you're jogging an hours outside in the summer, or if you, even though you're not jogging that long in the summer, you sit there, especially some people with overweight can tend to lose also a lot of fluid. So if that's the case, just remember the fundamental is 2.5 liters. on top of that, you need to replenish more, especially the summer, or depends on the activity. So this is about the fundamental basic need for the fluid. It could be any form of the fluid. For those people, if you're particularly if you're going the process of losing weight, or if you wish to lose weight, you take less food, less energy, then you probably need more fluid just to maintain the regularity. However, if that's the case, you need to really under the advice from the professional, either your physician or either your body weight management team will guide you what kind of fluid is best, because just water is not enough. Have to have the irons, has to have some component of the protein to maintain the onconic pressure, otherwise will be causing the edema. So that's another important concept about this fluid. So now talking all about this fundamental basic information, let's talk about the signs. What are the signs really indicating that that person is hypovolemic? The first signs feel heart beat faster than usual. For example, if your usual heartbeat is 70, elevated about 20% or increased to 90, that's really a sign. And also the feel blackout, especially when changing position. You feel like there's dizziness or feel black, and then you probably fainted. That's the worst situation. So these are the signs of the without the equipment to measure, just the fundamental signs, or if it's severe enough, feel dry mouth, and also the lips are not moistured, no tears for the baby, for the infant, and also you feel your skin dry. So these are all the very basic signs for the hypovolemic. If you have the equipment, or if your physician can, or if you're a caregiver, you measure the blood pressure from the lying down, from sitting, then there's a 10% of drop. Then or elevate the heart rate and drop the blood pressure. That's all the signs indicating lack of volume. So need to replenish either by the saline, or or saline or some other ions. If it is the caregiver, you can give this fluid. And if not, if you're just healthy, regular activity, and just busy on your project, try to finish without time to drink water, then you can just drink the bottled water, or just any kind of water. Add a little salt or no salt, depends on your daily diets also. So this is what kind of the signs to see the emergency without obvious damage. Like I said, fainted, and fall, especially elderly, a lack of urine output. For example, you usually go to the bathroom, or the elderly, your patient going to the bathroom, or your relatives going to the bathroom 5 or 4 times a day. Now is the whole day the diaper was dry, or they did not go to the bathroom. That's another sign. So these are the signs, and you really need to talk to your physician to guide you how to replace the fluid, especially for the older people. I'm not talking about the young, healthy athletes. After you exercise, you just replenish water. But particularly, I'm talking about emphasize those older people, or mental retarded, or Alzheimer, or dementia, or any other disease that cannot sense the thirsty. So these group of people in the summer, really, if you are families or you are caregivers, just pay a little attention, or make sure the fluid is sufficient to limit the hypovolemic condition. That could be very dangerous for those older people, particularly have the previous existing of heart disease, cause the hypoperfusion, that's the end organ damage. So it's not common, but it could happen. So I'm going to stop here. I hope the information can help you, just fundamental for healthy or for people with comorbidities. Thank you for watching. I will see you next time.